In Washington state, the death of an inmate last year highlights the atrocious conditions in the American prison system. I'm Yasmin Khan with the breakdown, and in December 2021, Clifford Ferrer, an inmate with type 1 diabetes, collapsed, had a seizure, then a heart attack, and died. His blood sugar had fallen to dangerously low levels, so, to remedy the situation, the staff gave him glucogen. However, this just spiked his blood sugar levels too high too fast, triggering the seizure and subsequent heart attack. Officially, Ferrer died of natural causes, but now his family is calling attention to what they claim is prisoner neglect and inadequate health care for inmates. Now, there are a few different angles to this story. One is the cost of insulin in the United States and the corporate price gouging that we've seen in the industry. Another is the poor conditions in the American prison system. And of course, another is the issue of whether or not access to health care is a basic human right that should be protected by the government. Type 1 diabetes is an insulin-dependent condition. As of data from 2019, nearly 2 million Americans are living with type 1 diabetes, and that number is expected to increase in the coming years. It's a condition that, with proper health care, is relatively manageable, and those with type 1 diabetes can live relatively normal lives. Without access to insulin, type 1 patients can see their conditions deteriorate quickly, sometimes within just a few days. And this is why the cost of insulin in the United States, specifically the monopolization and privatization of the industry and its inhumane levels of price gouging, is such a hot-button issue. It's one of the more insidious examples of capitalism not working for the people that often transcends the medical community and enters the national narrative. Insulin is life-saving, and those who need it really need it. Their lives are dependent upon it, so no matter what the price, they have to find a way to pay it. Some will argue that this is a simple matter of supply and demand affecting the price of goods. The demand for insulin is so high that it drives the prices way up. Still, this appears to be a uniquely American problem, as the price is several times higher than it is in any country anywhere else in the world. Just last week, this issue was thrust back into the headlines thanks to Elon Musk's ongoing blue check Twitter debacle. A fake Eli Lilly account announced that insulin was now free. The pharmaceutical company's official account responded saying, no, it wasn't. This triggered an exchange in which Senator Bernie Sanders tweeted, quote, "Let's be clear, Eli Lilly should apologize for increasing the price of insulin by over 1,200% since 1996 to $275, while it costs less than $10 to manufacture. The inventors of insulin sold their patents in 1923 for $1 to save lives, not make Eli Lilly's CEO obscenely rich." The result? Eli Lilly's value tanked, erasing $15 to $17 billion in market cap overnight. So with diabetic Americans already struggling for life-saving access to healthcare, incarcerated diabetic Americans are struggling even harder. In Clifford Ferrer's case, he only served a few months of his 2-year prison sentence before collapsing from diabetic complications. According to an article in The Guardian, Ferrer had spent much of those few months struggling to get access to the medical supplies and medications that he needed to survive. In August, he requested an insulin pump. In September, he had a seizure from low blood sugar, after which he again asked for the pump. He got the pump, but he was denied the glucose tablets that he'd also requested. By mid-October, his insulin supplies, which had previously been paid for by insurance he no longer had while in prison, had run out. He was then told that the facility could not help cover the cost for his pump supplies, quote, because the pump is personal property. On December 3rd, Ferrer lost consciousness, after which he again asked the facility to cover costs for his pump supplies. He said, quote, "I don't have the funds to buy the supplies needed for my diabetes care and survival." 3 weeks later, he died, leaving behind a wife and 9 kids. An investigative committee later found several factors that contributed to Ferrer's death. Healthcare staff hadn't been properly trained on emergency response procedures or equipment. The equipment was dysfunctional. Staff hadn't been updated on CPR protocol, and his insulin pump supplies had allegedly already been ordered, but they hadn't come in yet. The committee recommended that the Department of Corrections do a better job of managing diabetic patients as a result of the investigation, which just seems like a non-response to a very obvious problem. Americans, whether incarcerated or not, shouldn't have to die because of lack of access to healthcare. Now, while the healthcare for all debate rages on even amongst Americans who would benefit from it, and while we have billionaires on Twitter arguing that insulin price gouging is totally fine, there is some glimmer of hope for the future. In Oregon, midterm voters just passed Measure 111, a measure that would amend the state constitution, quote, to ensure that every resident of Oregon has access to cost-effective, clinically appropriate, and affordable health care as a fundamental right. In the richest country in the world, the "where's the money gonna come from" argument is played out and obstructive, only ever serving as a way to shut down a meaningful conversation before it can even begin. American citizens deserve more than our government has granted us. If every other comparable and less rich nation can find a way to care for their citizens, I don't accept the premise that we can't do so as well. All right, that's it for me. Lots more to discuss on these topics that I wasn't able to cover here, I'm sure. But if you got anything out of this, please like and subscribe, and be sure to follow me over on Instagram and TikTok. Thank you.